Imagine a virus spreading rapidly in one of the world's most populous countries, causing thousands to fall ill and prompting drastic measures from authorities. That's exactly what's happening in China right now with chikungunya fever, a disease you might not have heard of, but should definitely know about. With cases surging in southern China, local governments are scrambling to contain the outbreak. But here's where it gets tricky. How worried should we really be? And what does this mean for global health? So what exactly is chikungunya? It's a viral illness transmitted to humans through infected mosquitoes, primarily those of the Aedes species, the same type responsible for spreading dengue and Zika viruses. While the disease is predominantly found in Africa, Asia, and parts of the Americas, recent outbreaks have put it on the radar of public health officials worldwide. The symptoms? Think high fevers paired with excruciating joint pain, which can linger for weeks or even months. Though rarely deadly, these symptoms can severely impact a person's quality of life. And here's the catch. Because chikungunya mimics other mosquito-borne illnesses like dengue and Zika, diagnosing it accurately during an outbreak can be incredibly challenging. Now, let's zoom in on China's situation. Over 7,700 people in Guangdong province alone have been infected recently, according to reports shared by state media citing the China Association for Science and Technology. Foshan, an industrial hub within the province, has borne the brunt of the outbreak, with nearly 2,800 confirmed cases reported in just 1 week between late July and early August. Meanwhile, neighboring Guangzhou has also seen dozens of infections, and Hong Kong, China's semi-autonomous region, reported its first imported case over the weekend. Chief expert Kang Min noted that while efforts to curb the epidemic are showing some success, significant challenges remain. These include the risk of imported cases due to Guangdong's role as a global trade center, and environmental factors such as heavy rains and typhoons that create ideal breeding grounds for mosquitoes. What steps are Chinese authorities taking to tackle this crisis? In a bold move reminiscent of their pandemic-era strategies, top officials in Guangdong pledged at a recent meeting to go all out in combating the chikungunya outbreak. Their plan involves mobilizing communities to eliminate standing water sources where mosquitoes breed. Think emptying flower pots, cleaning gutters, and draining stagnant pools. State news agency Xinhua captured scenes of healthcare workers tending to patients under mosquito nets in crowded hospital wards, highlighting the scale of the response. However, some interventions have sparked controversy. For instance, residents in Foshan reportedly had little choice but to comply when workers entered homes without consent to inspect for potential mosquito habitats. Others were compelled to visit hospitals regardless of their preferences. Images published by state media depict teams in protective gear spraying insecticides across parks, gardens, and abandoned buildings. To enforce compliance, law enforcement officers have threatened businesses with fines of up to 1,000 yuan, $140, if they fail to address mosquito breeding risks adequately. In one extreme case, a sub-district in Foshan cut electricity to households that didn't adhere to disease control measures, a move criticized by many as overly harsh. But should we panic? Probably not. Unlike COVID-19, which shook the globe with its rapid spread and devastating mortality rates, chikungunya behaves differently. It's caused by a well-understood pathogen, isn't transmitted directly between humans, and almost never results in death. Chinese authorities have emphasized that the disease is both preventable and manageable, and the World Health Organization hasn't issued any specific warnings regarding the current outbreak in China. Still, the U.S. Centers for Disease Control and Prevention, CDC, has advised travelers to exercise caution when visiting affected regions in China. And this is the part most people miss. The parallels drawn between chikungunya and past pandemics may be misleading. Yes, China's aggressive tactics echo memories of their stringent COVID-19 policies. But applying those methods to a less severe disease raises questions about proportionality and effectiveness. Is it fair to impose such strict controls on communities? Or could softer approaches achieve similar outcomes without infringing on personal freedoms? What do you think? Does China's strategy make sense, or does it go too far? Share your thoughts in the comments below. We'd love to hear your perspective.